Hi, so I'm going to be talking about my Port-a-cath today. I had the surgery on Friday and so today is Wednesday, so it's been 5 days I think since I had it. And I had my first chemo a week before my Port-a-cath. So I'm due to have another chemo this Thursday, and I was meant to have my Port-a-cath before everything was happening with the chemo, but they wanted to start me straight away, and so we did that. And so we had to do the surgery for the Port-a-cath in between my first session and my second session. And apparently that's not that rare to happen, for the surgery to happen in between the first and the second. For anyone who doesn't know exactly what it is, this bump right here is where the Port-a-cath thing is. I'll put an image on the screen so you can see what it looks like outside of the skin. It's like a little nub thing that goes in the skin here, and then there's tubing inside underneath the skin, and then it gets in here inside the vein, and it goes down I believe into like one of my main arteries, one of the main veins. And so that way, when they put the chemo through this thing, it's just going to go straight into my veins and kind of like dissipate out into the rest of my body, instead of having to go up my arms and damaging those veins. And so people who are watching this probably already know that there are mainly 3 options for chemo. You have the chemo go straight into your veins, or you get a PICC line, which I'll put another image of somebody having a PICC line on the screen, where the tube goes into the elbow kind of thing and goes up the arm and then into those main jugular vein, I think, kind of like what the Port-a-cath does. But the Port-a-cath is underneath the skin, and so that way I can actually shower, I can go to the pool if I wanted to with it on. But with the PICC line, you can't get it wet. You have to change it every week. You have to go to the hospital and change the wound, the dressing. And so with the Port-a-cath, it seemed for me a better option, so that way it was just underneath my skin. I don't have to worry about it, don't have to think about it. It's just there, and then they can do everything through it, and I won't have to be have any kind of, hopefully, damage, or I'll have minimal damage to my veins, because that was something that I was really worried about, and that's why I wanted for sure to get a PICC line or a Port-a-cath. I know some people choose not to get either of them and they go with their veins, but I've just read enough and I've seen enough of other people's videos, or I've read enough of their stories on forums, and just hearing about the pain associated and the hardness of the veins from having multiple sessions of chemo. I just didn't want to have to go through that. I thought, you know, this whole process sucks already, that I have to go through chemo for my lymphoma. I want to reduce as much pain and discomfort and suffering as possible. And I thought, well, this surgery is going to suck. My arm has been very sore and my chest has been very sore for the last few days, but it's something that I can kind of get through. It's a pain that I can easily manage. I can, just take, my ibuprofen or paracetamol or endone to sleep if I need to, and then I feel okay. Whereas the chemo's kind of side effects and pain is different, and it's not as easily manageable, I find. Whereas this kind of pain is manageable, and it's something that I can easily deal with, and it should hopefully reduce kind of a deeper pain that comes with the veins later down the track. So that is a reason why I chose to have a Port-a-cath. Obviously there's no right way to do this. Whatever way is most comfortable for people is the best way. If you feel better having a Port-a-cath or a PICC line in, you should do that. But if you don't want to do that and you'd rather just go and see how long your veins kind of will last going through the chemo, maybe you can get through it all with just your veins, and that would be great. But yeah, for me, I just wanted to kind of avoid any additional damage, I guess, and pain or suffering. Obviously, it still looks a bit bloody. I'm sorry that I had to show you with still the bandages on. I can't take them off until I go to my next chemo session, and the nurses will take off the bandages and things and check that everything's okay. But they say that you won't really notice it. Obviously, I'll have this lump. I'll have a lump that kind of protrudes, and since I'm very thin as well and a bit bony, it protrudes a bit more than maybe for some other people. But to me, I really don't mind. I just know that it's gonna reduce suffering and things down the track. So I'm really glad that I have it, even though it looks a little bit odd that it's kind of poking out there. But I love wearing scarves and things, so I can easily hide it if I want, and I've been using them a lot recently because of the surgery. I haven't used it yet, so I want to know what the experience is like to actually have it accessed, and I'll probably make a video about in my next chemo session, just talking about how it was to access it this way, because my first chemo session, they just got it in my arm here, which was painful to, you know, get into the muscle there, or past the skin muscle. I find it's a bit more painful when they do it here than here. I normally don't do needles in my hands because they've just struggled in the past. When I got my wisdom teeth out in the surgery, they just couldn't get it in, and they just tried multiple times on both hands, and it was just a bit too traumatic. And the last thing I want is them to keep trying to poke, and then I hear that sometimes when they get the wrong vein, it can kind of like, you know, the vein can swell, and that can be really painful, and I just want to avoid. I want to, whatever I can avoid pain-wise, I want to avoid. Yeah, so I find that a bit painful, so I'm hoping that here it won't be so painful because the skin is like kind of thinner. It's meant to be just underneath the skin. There's like no muscle or anything there, so hopefully it should be really quite painless, I hope. But I will talk about my experience when I go in for my next chemo session. And I also know that they can extract blood, like for a blood test they can do that here. I haven't done that yet because I still want it to heal. I want it to heal properly before they start poking around, because it is still a bit tender. But I'll also talk about how it feels to get blood taken out, and, you know, maybe I'll just go with my arms for my blood, because that way at least I know that my arms will be fine to take blood tests, and all my chemo can go through this thing, and hopefully my arms will stay healthy in terms of the veins, so that way I don't have to worry or get any extra anxiety about needles when they go for blood tests. Another thing I probably should mention about the Port-a-caths, there is a chance of infection and of blood clots, so they do need to flush it, I believe, every 4 weeks. But since I have chemo every 2 weeks, they'll probably clean it, I guess, during that time, so that way we can really stay on top of any kind of infection. And it's also, you know, everybody's different. One body might reject it and then you have to take it out, and that's obviously going to be a really unfortunate experience. But I know that there's always a chance of infection. With a PICC line, you also have a chance of infection, and I felt like that seemed to me like a higher chance of infection. I'm not a medical professional, and that's probably something I should quickly research, but in my mind, logically, it feels like there would be a higher chance of infection because you have to keep changing the dressing, you have to be very careful about making sure it's not wet. Whereas this, since it's all underneath the skin already, yes, there's a chance of infection during the surgery, but once the surgery has been done and it's been healed, and as long as they flush it out, I feel like it's probably better because it's not like an open wound, whereas with the PICC line, it's still kind of poking out, protruding, so you could technically still get an infection there. So obviously there's still, you know, a chance of infection. You have to be very careful with it, especially during the healing time after surgery. But to me, it felt like a less risk. You know, I have to go through the surgery. I went under general anesthetic, which, you know, you obviously don't want to just do willy-nilly. But I'm glad that I did it. I'm glad that I'll have less chance of infection. I'm glad I can still have my showers and baths. You know, they give me so much strength, and this, you know, a great luxury in being able to have a hot shower or a hot bath, especially when you feel like crap. Or finally on the day that you feel good. It's nice to just have that great pleasure of life. And so I'm really glad that I'll be able to do it with this and not have to worry about, but you know, I'm sure with a PICC line you could probably wrap it or something, but I'm just glad I don't have to think about it. So I think that sums up this video, just talking a bit about my experience, why I chose to get a Port-a-cath, and also some of the like kind of things you have to be mindful with the Port-a-cath. You know, if you have any more questions, just write them down below and I'll try to answer them best I can from my experience and from my knowledge, and I'll try to do extra research if there's something that you're asking that I'm not sure about. Thank you so much for watching, and I'll see you in the next video.